Morning, everyone.
Good morning.
We'll call a meeting to order the Board of Health on Monday, April 12th at 8:30. Roll call. Who's taking minutes? Everyone here? Except Kim.
Yeah, but just hold it. And then if you look on the other side while you're doing that, it should just wake up, turn red.
She got the green light there. Is there a motion to approve the agenda? Motion by Ginny, seconded by Milt. All those in favor signify by saying aye.
Aye.
All those opposed say no. Approval of the March minutes.
I move to approve the minutes.
I'll second.
Who made the motion? Milt and
Second.
Jeff seconded it.
Motion was made by Julie Janison. Motion was made by Julie Janison.
Okay, yeah. Seconded by Jeff. Is there any other discussion on the minutes? If not, they will stand approved as read. Is there any citizens input this morning? Seeing none, hearing none, we'll go on to COVID-19 updates.
Good morning, everybody.
Good morning.
All right, so couple updates for you with COVID. Unfortunately, our case count's going back up on the rise. So when I talked to you the last time, we were on a decline. About 3 weeks ago, we were sitting between 6 and 8 cases active in the county. As of this morning, we are at 23. So we're 3 times where we were 3 weeks ago. And that rise is probably secondary to having spring break and also having Easter. So now we're within the week to 2 weeks after that, and we're seeing those cases increase. Our total cases overall since the beginning of the pandemic are at 2,588, and we have increased in deaths by 1 in the last week. I wanted to share with you where we're at for vaccines. So I showed you a dashboard last month, and within that dashboard, our county sits at 32% vaccinated, with 6,685 vaccines having been given throughout the county. That number is every vaccinator. So that's including the people that go to Green Bay, that's the people that are going to hometown pharmacy, that kind of thing. On Friday, I did give you an update that had our actual numbers in it. And we've done a lot. So the majority of those vaccines actually have been the health department. We sit at first dose being 3,259 given by the health department. Second dose, 2,396 for a total of 5,655 doses being given by your local health department versus that total number of 6,685. So we're really one of our only vaccinating entities for our county. And, you know, we do see people, like I said, going to Green Bay and things like that, but our numbers are not huge in vaccination overall. We fall below the state average right now for vaccines. Wisconsin is sitting at 37% vaccinated with the first dose, and 78% of their 65 plus is vaccinated. Right now, like I said, we're at 32% with that first dose, and about 70% of our 65 plus has been vaccinated.
Cindy, can I ask you back to the amount of
infections, what the average age is?
It's been younger, so we're not seeing those infections in the 65 plus group. We're seeing a lot more of them in the school aged group or the 20 to 35 year olds. Mhm. Yeah. Just a few other things in regard to COVID. So we did issue a masking advisory when the state mandate went away a few weeks ago. That advisory simply states that we continue to recommend masking if you are in a situation where you're going to be within a crowd or in indoor buildings where several people are within 6 feet of you. So, you know, it's still recommended in school settings, in face settings, and those kind of things as much as possible. Within our schools, to my knowledge, Algoma continues to mask within their school. Kewaunee at this point is masking within their school. Luxembourg-Casco, unfortunately, voted last week to not mask within the building and not mask outside, with the exception of common areas. So in the cafeteria, in the hallways, those kind of places, they continue with that masking. I was at the meeting. Our recommendation was not that, but that's how they chose to move forward. And hopefully they will revisit it if they see their case counts in the schools go up.
Cindy, is there any are there any recommendations going to be given, regarding schools as far as the rest of the school year? Obviously, a lot schools in the county have been in-person instruction. I'm just thinking Memorial Day weekend. Obviously I look at calendars and it appears to me that they're going to have a Memorial Day weekend where everybody's going to travel everywhere. And then they're only coming back, I think in some cases for 3 days. I wonder, I've thought about that. Is that something that should be possibly visited or a recommendation from your department?
I mean, we haven't put on any formal recommendation.
I know you don't follow the calendars as closely as I
yeah,
might.
and other than just to my message to the schools in the last couple of weeks was you've done an amazing job staying open for the first several months of school, and we have 8 weeks left. And my recommendation would be to continue the exact same thing that you've been doing to hopefully follow through that rest of that school year open. So, I'm going to continue to recommend that. I'm going to continue to have them proceed with caution after events such as Memorial Day. I'm a little nervous about the proms that are going on. Each of our school districts has chosen to host prom offsite because the school's not sponsoring it. So we're going to see proms taking place at the end of April too. And that's going to be another one of those situations where I think we're going to see a spike in cases after that.
Do you think the Memorial Day weekend, I just think of how much more travel, people are much more likely to travel. I believe, I never have, but I believe that most people are much more likely to travel out of the area and things over Memorial Day weekend. Do you think that is going to present a problem?
It certainly did last year during Labor Day weekend, because that's when we saw our cases spike super high. So I think it may be of benefit to our agency to put out a recommendation that says that if you are doing travel and are unvaccinated at this point, to possibly self-monitor for at least 7 to 10 days after that.
Yeah, I don't think any of the schools in the area had to take a snow day this year.
Correct.
And so they would have I know it presents scheduling nightmares, but I believe that they would have the days.
Correct.
Be able to adjust. Perhaps that would be of benefit.
Yeah, I think it was an interesting decision that, even Kewaunee chose to go back to full in-person the day after Easter, versus holding off one more week to see how that went. So I think it's, there's a trend throughout the United States. We're seeing a lot more things open. We're seeing a lot more people just more laxed and going out and returning to normal. And we still only have 30% of our county vaccinated. And I think I remember showing you that arch last month where there's that section that's grayed out at the end, and it's 20% of our county grayed out because they are of an age that cannot be vaccinated. And that's the school population where we are seeing some of that spread and uptick there. So I don't know if you have an interest in maybe me making a statement that just says to
Well, I mean,
proceed with the schools.
Yeah, I mean, it's kind of a little bit selfish, or not selfish, but personal on my part, because we actually decided, because we have an abundance of snow days, we actually decided to extend, take the Friday at Memorial Day weekend, making it a 4-day weekend. And based on what I just heard you say, I'm now thinking maybe I made the wrong decision. Maybe what I did was, absolutely the opposite, although I didn't have this information prior to 5 minutes ago. So I'm thinking perhaps I should have, perhaps we should look at being in on the Friday and then ending. Though scheduling wise, obviously that creates, challenges, but
Yeah.
Certainly I know in my case, we have the hours because of the, lack of snow days.
Correct.
So that may be something that's just what I was thinking. I mean, I just got this information 5 minutes ago. So, I'm processing quickly, but I do think that there is, I do think if based on what I just heard you say, I do think that there, the Memorial Day weekend is a time, my understanding is that people are much more likely to travel out of the area and be all over the place and then come back. In many cases, or in some cases, I know it's for a very short amount of time,
Correct.
which educationally is really not the most productive time anyway. I'm wondering if it wouldn't behoove the schools, if they, everyone has a different situation, I mean, for sure. But if possible, I wonder if it wouldn't be, of benefit to everyone if arrangements could be made to call it
Quits at that
quits.
point. Yeah,
I mean, and just avoid that whole thing.
sure. And it's a conversation certainly that I can put out to all of the districts and the parochial schools and see,
Yeah, because
where they're at.
because certainly if you put a statement out like that, I suspect that, we would definitely, I think we would be very likely to make an adjustment.
Mhm.
Based on what I just heard, now 7 minutes ago,
Yeah.
I think it definitely would be worth taking a very serious look at, because it seems to me that it would have benefit. I mean, just why find out?
Why take that risk?
Yeah.
Cindy,
Thank you.
I'm sorry.
Go ahead.
Did the cases go up in the Kewaunee district following Easter?
We've seen just an increase in cases in general, with more school age students, affected. We were down to next to nothing 3 weeks ago. So yeah. Virginia.
The Domestic Abuse Agency decided to go ahead and do their annual event in June, and they decided to not have anything inside of a building. Everything's going to be in Legion Park. But do you have some kind of guideline you'd like to send back to that group and say, this is what we want you to do on Legion Park?
What we have still encouraged is that they try to social distance even when outside to the best of their ability, and to use a little bit more caution when serving food and things like that. And it's kind of that same message that I shared with the fair board, try to do more sanitizing of tables in between, have hand washing stations available, clean your bathrooms more regularly. All of those kind of things will help.
Yeah, they decided to quit it early in the afternoon instead of being into the evening, hoping that people wouldn't be hanging around eating and
Right.
socializing and that. So, but they need to do it financially.
Right. And I think
they depend on that.
We're just going to see a lot more outdoor events taking place. I know that several of our school districts are taking part in spring sports. I know that it was a question as to how to bus some of these spring sports because, for instance, a track team is quite large in comparison to a baseball team where you can fit them on one bus. So there was a lot of questions in that regard as well. And I have encouraged them to still take precautions in those measures, be doing the masking and the social distancing to the best of their ability through all of that.
My granddaughter's a senior in high school here, and she's had her first vaccination. And has there been anything sent to the schools or anything about, hey, you're in that category now, you can get vaccinated?
Yeah, we've shared a message with schools that now it's open to 16 plus for Pfizer doses only. So it's a matter of, it's difficult to schedule with the schools because we have to schedule it out, you have to have a week or two notice on what you're getting to coordinate all of that. And right now we have a week or less notice. It's a similar struggle with what we're doing with the businesses, just to get that all organized. And then we're really going to have to check birth dates on that because, you know, in some people's minds, their 15-year, 10-month and 26-day child is 16. And in the state's eyes, they're not. And then we get a call and we actually have to file a VAERS on that, which is a vaccine incident report with the CDC if we vaccinate at the wrong age. So it's very, very specific. And that's where some of our concern with opening it up right now, lies. I did want to share with you that we have been busy with doing a lot of our area businesses. And so we've been offering more and more vaccines out in the community, not just at the expo hall, but also just right on site with our businesses. So earlier in the winter, we finished up McMahon's Funeral Home, Wiesner Massart Funeral Home, both Buchanan's Funeral Home. We've done ABC Dental, Sperber Dental, the Luxembourg Pharmacy. Recently, we've done Volrath, NEW Plastics, Northbrook, the Multicolor Corporation, DRAM. We've also and Olson Fabrications will be this week. They're scheduled. And then we've also done a big outreach to our farm community. We've had the assistance of UW Extension with that. So we have Ebert Farms done, Pagels, Dairy Dreams, the Bry Farm, Cornett's, Bodwin's, Seidel, Mountain View Dairy, Schleiss Farms, and Melcor Farms. And we have several more of those that are now calling in and we're trying to reach out to them. So that effort will continue. I need you to know that on some of those, the vaccination rate's not great. So they may have 100 employees and they may have had 25 people take that vaccine or less, but we're still offering it and we're bringing it there because what we're seeing statewide is that if we go on site, they at least some of them get it. Whereas it's very difficult for those employers to shut down or to enable an entire staff to go during a certain time where clinics might be available.
Cindy, can I ask you about self-testing? There's these self-test kits. Are they, number one, accurate, affordable, and are they recognized as an actual test if you need to be required to have a test to have access or a vaccine?
Sure. So I believe there's more than one company that's offering those, but I know that the state of Wisconsin offers those. So you can contact the state. They will mail you a test free of charge. Everything about the testing is free. The only problem that I've heard with it is the turnaround time. So by the time that you contact them, they mail it out, you take the test, you mail it back. It's a good 7 days turnaround. So if you're looking for something quick, it's not the answer.
What would be?
You can still go to some of our area testing sites. Clinics are offering it right now. Prevea's turnaround time here in town is about 24 hours because they've seen less testing requests throughout the state. The turnaround time has gone up considerably. Any other questions on COVID?
What about the side effects from the second shot? I've been hearing a lot of stories about the second shot and having side effects.
So we've seen fairly minimal side effects and we have given all three. So with Pfizer, the side effects tend to be more tired, a little bit achy. And for people over the age of 55, they experience less side effects than people younger. So the population that has really experienced the most side effects with the Pfizer dose has been that 20-something crowd that was either in the workforce or in, like, say, CBRFs or CNAs. Those kind of people got a little bit more achy, sick, down and out for about 24 hours. The interesting thing with the side effects with all three of these shots is that they come on quick and they leave very quick. Moderna has a higher side effect rate with it. And I think probably the number one side effect that we hear more about Moderna is nausea and vomiting. It has a closer to 20% experience with nausea and vomiting, where Pfizer is at 1% nausea and vomiting. So I think when people say that they're getting sick from it, that's the one that sticks in my head the most. Johnson & Johnson has some side effects. I think that we hear that they get tired, sore arm, and nauseous with that one. Well, I haven't heard a whole lot about any of our people that have experienced that. So we've really had very minimal complaints of side effects lasting more than 24 hours.
So we don't hear anything. I haven't heard anything recently regarding antibodies. You know, back before the vaccine was even a thing, everybody's like, you're going to have an antibody card and that's going to be your ticket in. And now it's just like, it doesn't matter.
Yep. So antibody testing, they do fairly regularly. And the unfortunate thing with antibodies, whether right now it's from the vaccine or it's from the actual disease, is that they can tell you that it lasts about 6 months because that's all that's been studied. You know, it's fairly new. So, you know, I've heard a lot of people say, well, this vaccine only lasts 6 months. Well, that's all they can tell you because it's only been available to the United States for 6 months. So, you know, I think we're going to see that antibody data improve.
Because
But it's gonna
technically
take over
they can only compare the vaccine the same way.
Correct.
So it's argued that the antibodies is a better way to fight the disease
Yep.
versus the vaccine,
Yep.
but yet neither one has a long enough history.
To tell you the truth,
tell you
either
the
way.
truth.
Yes, correct. And you know, what we had been seeing was that the CDC had this excused from quarantine period of 90 days after you've been sick. So once you had the disease, you were considered immune for 90 days. And they were just about to go out to 6 months with that when all the variants came from England and South Africa and now Brazil. And so they really don't want to put that out there yet because they want to make sure that all of the vaccines are covering those variants. And my knowledge is that from preliminary trials and things that they're watching, that it has been covering it. But, you know, we're seeing an increase in those variants right now. Michigan, I heard this morning, leads the nation in the most COVID cases. So it's our next door neighbor and they're highest in the nation. And it's because they're seeing a huge influx in that UK variant.
So if you get tested for antibodies, does that mean that you're still immune if the antibodies show up, or the antibodies always going to be in your system for the rest of your life? It's just you may not be immune. I mean, how do they?
If they
Does that
show
mean
up,
anything?
if they show up, what they do is they count it. And so within a certain level, you should be considered immune.
So you would think they would still be able to do a test like that for people and say, okay, your antibody count is X.
Mhm.
You're still good and you should be good for.
Yeah, hopefully we get that data soon.
What about the younger people? I'm hearing, you know, I hear a lot of different concerns that people have about younger, you know, the folks 16, 17, 18 getting the vaccine. There's studies. I mean, what information do we have? I assume that it's been tested and is
Yeah.
safe.
So it's being tested the same way that it was for the adults. They're testing down, I believe, now to age 12. And they do believe that by, you know, mid to the end of summer, we will be seeing vaccinations available for kids 12 and up. Specifically, I think it was Pfizer that's been running those trials right now. Yeah.
So we still have to do a COVID, but at 9 o'clock, we're having a tornado drill for the building. So she probably over the phone. And at that time, you guys will go downstairs, you're just gonna check in. And then you'll be able to come right back to where you were at.
Perfect. Thank you.
You have to go under our desk.
That would not be a tornado drill.
How about if I leave them
All right, see you guys downstairs on 9 o'clock.
Thanks, Tracy. Any other questions? All right, then I think that's all we've got on COVID right now.
Okay, on to the March monthly report.
Okay, so you can see that our contracted caseload for WIC is 218 and we are hanging at about 206. So we're making that 95%. So we're doing very well there. Once again, we are one of the few counties that has been fairly open with our WIC population. A lot of them are either still closed down or offering very limited services. So we're really happy that we've been able to maintain being open and offering that. Immunizations, we did a lot, 2,603. So that's including a lot of our COVID in there, but we are still open to regular vaccination as well. As far as our communicable disease report, we had 1,131 diseases reported to us, confirmed 180, suspect 1, probable 44, and not a case 906. Every case that comes into us, just so you know, I know that not a case is 906, but we still have to do a full investigation to make sure of that. So they're all time consuming. Questions on any of the office visits or meetings that were attended? Okay.
No further questions on the March monthly report. We'll go on to agency updates.
So as promised last month, I told you that I would try to reinstate bringing one of my staff members up to report off on some programming that they are working on. So today I have Jessica here and she is going to give you an update on the PALS program. All right, there you go. Give it a minute.
You got 2.5 minutes.
Did it go? It was on.
Still thinking.
Yep. All right. Red's not good. Green is good. There you go. There you go.
Okay.
Awesome.
All right. Hi, my name is Jessica. So I am doing the PALS program, which stands for.
It's keep it on.
Oh.
Push it and make sure it stays green. There you go.
Okay. There, I can hear myself. Okay. So the PALS program is physical activity for lifelong success. So this is a program that's offered to individuals who are over 60 years old and are more sedentary. So they get less than 60 minutes of exercise a week. The program is 3 days a week. So it does a physical activity component of it, which is about 45 minutes. And then one of those days, we also have a lifestyle class. So that just kind of goes over different things that they can help work on like at home, kind of like nutrition, different stretches, things like that. So we went to a training last year in March and we had it started up in September, but then with COVID and everything, we had to postpone. I was hoping to get it up and running potentially like end of this month and into May, but then reaching out to individuals who are interested in the past, they either didn't meet qualifications anymore because they already had some of the exercises, so they were active for more than the 60 minutes a week, and other individuals who just weren't ready to join quite yet. So now we're looking more at probably like June 14th as a potential start date, and then that will be a 10-week class. So they come in for the 3 days for 10 weeks. And then after that point, there's a 6-month follow-up period. So it'll be either in person or over the phone, just kind of touching base, making sure that they're still maintaining activity, implementing some of the nutrition that we go over, things like that. But this has been a research-based program, so they have seen a lot of these individuals who do complete the whole 10 weeks see improvement in their gait speed, so how fast they're walking, and then as well as like the distance that they're able to walk. And with that as well, they see improvement in like everyday lifestyle things. So like reaching up into their cupboards, getting out of a car, preventing falls, things like that as well. So it's a really good program and I'm excited to get it up and running. It's just a matter of getting those individuals in, and they have new restrictions as well with COVID. So we were up to the max amount of people we could have was 12 when we first started, but now we're down to 8 participants. So I'm thinking with the promotion and everything that we are going to be getting out later this month, that we will have that interest and have the max amount of 8 people in the class. So yeah.
Just a note with that program too, this is one that we received a grant on prior to COVID starting. So we had a grant a year plus ago, which bought us all the exercise equipment. So we'd really like to start to utilize some of the fun stuff that we have down there, from free weights to exercise balls to, there was a bunch of stuff. Yeah, steps, that kind of thing. So we are set and ready to go with all of that.
And where is that held?
It can travel anywhere. So I don't know that a destination's been specific yet.
Yeah, so before we were going to do it at the Kewaunee Fitness Center here in town, but I actually reached out to the youth center in Algoma, and we're looking at using their facility. It was just a little bit more flexible with like the timing and everything, because they do hold classes at the fitness center at certain times.
How do I sign up?
Yeah.
We'll have Jessica reach out to you. Okay, Kathy, she'll give you a call. Yeah. All right. Any other questions for Jessica? Super. Then as far as the rest of my agency updates, I won't keep you real long. We are now working on our annual report. I know about a year or two ago, the county board decided that each agency would not have to specifically report out to the county board. However, according to state statute, I still need to do that. So I will have that annual report completed by May 1st, which is a statutory requirement for us this year. And then I will share that with you, and I will let you guys make the determination if you want it presented to the full board or just to the health committee. We are also trying to work on some summer school planning. So we'll be reaching out to our districts to let them know that we would be happy to assist in programming that will help increase awareness of childhood obesity, which we have done over the last several years. So we offer some fitness related classes and also some culinary kind of classes that increase their awareness of healthy foods to eat, maybe making healthy snacks, preparing food when they're home alone, those kind of things. And I just wanted to let you know that we did reach out to the state, and we will have for sure one student intern, hopefully 2, that will assist us in working on our community health assessment and community health improvement plan, which we're both due in 2020. And yes, we are a year behind on that, but we were forgiven because of COVID. However, they're not as forgiving anymore. So we're going to at least try to get that going, and then we will include you in some of the awareness of it in fall, and hopefully be able to either do something live or at least virtual to the community to let them know our plan moving forward for the next 5 years. Questions? All right, that's it.
On to the financial report.
So you have 2 financial reports in front of you. One,
I think I need them.
oh, sorry. Yep. I think I handed them out before. One of them is marked February in the top corner. So that's your most recent monthly report. We're on track with most of our spending. We have not spent down much of the first 2 categories, which would be the general public health, which is 54100, or the 54106, which is the county funding for immunization. Currently, we are using more grant funding that is available to us because of the COVID efforts moving forward throughout the next year and a half. Does anyone have any questions on the February report? Okay, then the next report that I provided does say, I think, end of year. year end, sorry. And that's the one for 2020. And what I can highlight for you is on the back of the first page, that is the 54100 category, which is our general tax levy dollars. Remaining in the budget for the public health department was $33,397. So that was given back to the general fund. And then moving down to page 2, you'll see the number 54106. That is also tax levy funding, and that is for the immunization program. And we gave back nearly 5,000 there as well. Those dollars were not used because we used the CARES funding that was coming into our agency for the efforts that we were putting out. On the WIC programming, the next category down, 54113, we did end up with some monies left there as well, simply because WIC really was very limited in the services that they could offer and how that money could be used if you were not open and in person. So we spent on as much as we could with that one, but there was still some remaining in the budget, about 5,000. Other than that, you will see the majority of these grants at zero. I joke with Deanne all the time that she's great at getting it down to the final cents in all of those grants. So she did very well helping us keep on track with that. There are a few grants that carry over beyond that year. So you'll see some funding left in there. Prevention is one of them. And then going further back, under public health emergency response, that's when you see that CARES funding come in, and many of our bioterrorism / CARES dollars carry over year to year. So you're seeing 179,343 in there, and that's because that money carries over into 2021. Questions on the end of the year budget at all? Okay.
Any travel requests?
No,
Any overtime to report?
the only overtime that is being paid out by our agency is in COVID response efforts. We have still very minimal. All of that is being paid by grant funding through ELC at this time.
Are you still contact tracing on the weekends?
Yes, absolutely. But our contact tracer on the weekends is not one of our full-time staff. So therefore that is not overtime for her. It is just straight time. Sydney is one of our college students that has agreed to do that for us and will probably stay on with us through June. She does graduate in May and then is moving on to Milwaukee.
Next meeting date? Looks like May 11th. No, excuse me, May 10th. Is that okay for everyone?
Sure.
At 8:30? May 10th at 8:30. Any other matters? If not, a motion is in order to adjourn. Kathy, seconded by Jenny. All those in favor signify by saying aye. Aye. All those opposed say no. Motion carried.
I don't know, but we didn't hear about that tornado drill and it's 10 after 9. So either it was canceled or I'm not sure what happened, but thank you, everybody.
Thank you, Cindy.